Hi everyone, it's Gina Lee, and I'm excited to be here with you today. It is December 14th, 2017. I'm 6 days post-op. I had my surgery on Saturday, December 9th, 2017, in Tijuana, Mexico, called A Lighter Me with Dr. Ortiz. Um, my highest weight was 243, but I count my weight when I began at 238. And at pre-op, I was 227, and I haven't weighed since then because they say, don't be discouraged by weighing because you're filled with all those IV fluids. And, I had a 7-hour drive home yesterday. So I'll weigh on Sunday. So hopefully I see, a few more pounds lost. So I was on a 3-day pre-op diet that was all liquid. Before that was I could have some salads and 6 ounces of protein. So before this started, I was 3 days with just water. I drank Propel. I had chicken broth and the sugar-free popsicles and some Jello. But I got really bored of that, and then surgery happened, and so the experience I had was, well, in Mexico, we have a website that we're all on, and a lot of people say it was really great. It was a good experience. They were very helpful. There was a language barrier with the nurses, not with the care that we got from the Lighter Me people, but the center is called Me Doctor. It's a hospital. And sorry, it's called Me Hospital. And it's a surgery center for bariatric patients that is an outsource. So a Lighter Me does not pay the nurses at the center. They're their own entity. So the quality that you get with a Lighter Me employees versus these people was a bit different. It's an older place, but it is clean. I can say that it was kind of weird when I walked in to get my EKG at the very beginning. He handed me a gown to put on open at the front, and it was just sitting on a table, all opened up. It hadn't been folded. So I wondered, well, does this get used on more than one person? It was just something that popped in my head. I had problems with my IVs. A lot of people have problems with their IVs. I don't know if that's normal. I don't know if I was in a regular hospital, if that would happen. I've never had an IV for several days, but first they couldn't even find veins to use because number one, I was dehydrated. And my veins are smaller to begin with. So I had two things against me. So they poked me in both hands and, that wouldn't work. They got bruised up. They finally got a vein in my upper arm that lasted through the surgery. But then the fluid started leaking out into my arm, making a big, bump. So they had to take that out and move it to another arm, poke me several other times when they finally found another vein. But I had to hold my arm straight out because of where it was. And if I bent it, then the fluids would start building up in my arm, so I'd straighten it out. I didn't want to do any more IVs after that. So I was really careful to hold my arm out like that. So we were there that day, had surgery probably around, I think it was around 4:30. There were a few patients before me. Met a few really nice friends that we are planning on keeping in touch with. I visited with one of my friends that had the surgery the day before, Sarah, and that was nice seeing her. I personally would not recommend going alone. And I would recommend taking someone that speaks Spanish. I know that's a rarity, but whenever there was any issues that I had with my medication or what I was actually being given, which I don't know, maybe some people just go with the flow, but I wanted to know what they were giving me, what was the name of it, and how often am I getting it. And so I would have to kind of have a translator for that because there was that barrier. And same thing with the IVs, that was kind of an issue too. So I would recommend having someone with you. Although many people go alone, that's just not something I would have done. I was going alone, but thank goodness that my friend Toots went with me. So after surgery, they said my blood pressure was low. I could hear them talking, but I didn't ask what it was. I didn't want to know because I didn't want to scare myself. And then my stomach was gurgling. It gurgled for days and days. Probably just stopped gurgling. I just heard it right now, but it just was making all types of noises. So I started drinking water really slowly. And because I don't want to become dehydrated, that is number one thing. You do not want to become dehydrated. So always keep up on your water. And then we stayed another night in the hospital and walking around. They say to walk around to help with the gas. And then we were released Monday morning early, we were released at 7. We went down to a little waiting room because the lady said that they didn't have enough rooms and they had to get the rooms ready for the next patients coming in, which they did. So they definitely have this system down pat. They have people coming and going like clockwork every single day. I can only imagine how much money that brings in for them. One night outside by the nurses' stations, they're all young, nothing against young people, but they're all young. Didn't seem to me like there was like a supervisor, but just nurses. And a nurse came in and said, "Is there anything else I can do for you?" And I said, "Yes, could you tell those people to be quiet? They were just so noisy, and I think they forget, what we're going through." We didn't have an air-conditioned room. We didn't even have we had air conditioning in there, but it wasn't monitored by us. It was monitored out in the lobby or I don't know, somewhere. It only worked the very first day, and then after that, we didn't have anything. Other people had little air conditioner units in their room that didn't work. Some people's beds were having problems, but I fortunately didn't have that. And I have a TV in my room about the size of my computer screen, but I didn't complain about that. So there are American channels you can watch. Anyway, we were released and we went to the hotel, and that was much nicer. The hotel is just really comfortable and clean, white linens, and it has a pool outside. We can't go in it, but we looked at it, and I came home with a really bad migraine, but I think that was just me. I suffer from migraines anyway. So I wasn't sure if I wasn't feeling good from surgery because everyone was saying, "Oh, you don't look good," but I think more it was from the migraine. And then the next day I felt a little bit better. They give you nauseous medication there, and the nurses check on you twice a day and change your bandages once a day. And then they do a tour. They took everyone on a tour to a pharmacy, of course, where you can spend lots of money on stuff you may or may not need. To me, that's just the tourism part of it. It's probably like they get a kickback from it. They went to some restaurant where they said you could have a potato cheese soup without the potatoes and cheese. It was just strained. And Toots brought me back some. I didn't go on the tour, but it looked like tomato soup. It was too greasy. I didn't eat it. And they also went the next day to the beach. I stayed home for that too. I wanted to just make sure I took care of myself. I didn't want to overdo it. And then that night I did get a pedicure across the street. So that was kind of fun with Toots and our new friends, Amy and Galen. So I got home yesterday. We drove home 7 hours. I drove, so it's possible. I went to bed all night with gas pain. The first night I had gas pain, it feels like cramps. And, I've had laparoscopic surgery before where the pain shows up in your left shoulder. And that's what I thought I'd be feeling, but I didn't. I felt actual cramping in my abdomen, in my lower abdomen. And I took some Gas X and put on a heating pad, and then finally I just curled up in a ball and fell asleep, and I was grateful. So I woke up today feeling really good. My cousin had surgery here in the States. Her diet consisted of 3 days clear liquids, and then on the 4th day or something like that, going to protein shakes. So it made me think. I went to I had started this here in the United States in Tucson. I went to all of my appointments and they gave me what I'm supposed to be doing after surgery. So I went to look at what my doctor had given me here, and it actually said 3 days clear liquids. On the 4th day, begin protein shakes and creamy soups, but low fat. So I had a protein shake today and I feel so much better getting some protein in me. I only drink half of it, but I'll get the rest down later. So I feel really good. My incisions are small. There's no problems with them. Like I said, the gurgling was probably the biggest thing for me with my stomach. I hadn't heard of anyone talk about that before. Of course, I probably expected it, but it just won't stop gurgling. So people will ask me, "Are you hungry?" And I said, "I can't tell because I'm not sure if that gurgling's like a hunger gurgle, or if it's just gurgling because it's healing." So I learned to drink water really slow, and I've noticed in the past 6 days I'm able to drink a semi-normal drink. It's still slower, no gulping. I haven't had any problems with extra saliva or something sticking, but I'm very careful with what I do. Which brings me to this. This is it for me. Like, this is a lifestyle change. This is not about, oh, I can have this, but just in moderation. I can have a French fry, not now, but in a few months. I can have pizza if I want, or I can have, this or that. No. I know people ask on the Facebook forum. Um, well, one girl said, well, my boyfriend and I always cuddle on the couch and drink hot chocolate and eat chicken wings and blah, blah, blah. And I'm bummed I won't be able to do that. And I said, girl, if you're doing that and you're worried about it, you're not ready for surgery. This surgery is about a lifestyle change. And the biggest thing for me is this was a tool to help remember that I can't eat those foods anymore. I always thought I could have had willpower and I could have stopped myself, and I did from time to time. But now I know I can't eat that. I don't want to eat it, and I'm not doing that. I think for those people that just go back to the type of foods that they eat before, they're just setting themselves up for failure years down the road. I'm older now. I'm done. I'm done with that. I'm not doing it, and I hope for the younger girls' sakes that have the surgery that happens with, that they really learn to change the way they eat, not just eat it in a smaller amount. That is not the goal. Yes, you can go out to dinner and have, pasta in a small amount. Yes, you can have steak if you want, or you can have a baked potato, and you can even have French fries. But those should be treats few and far between. It should be about eating a healthy diet, the kind of diets that people eat who are thin, the kind of diets that people eat who have good nutritional values, and they don't eat the processed foods, and they shop the outer edge of the shop grocery store, and they make their own foods at home. And yes, they splurge when they go out to dinner, but they keep it in moderation. I'm just so surprised at how many people don't do that. So I hope that you get something from this. I'll be happy to answer any more questions you have. If you decide to take this surgery to Mexico, there's a lot more I could tell you about, but I don't want to bore you with it all. So if you're interested in that with a lighter me, then I certainly will be happy to answer your questions. I'll put my email address down below there as well, or you can just comment below. And I'm really grateful for the new friends that I made there. And I'm really grateful that Toots went with me. So that was just awesome. So hopefully you all are going out there with the mindset of this is a new change for me. I'm done with the old stuff. Don't tempt yourself. Don't start with it, because even if you're okay and you lose the weight and you're 3 or 4 or 5 months out, 6 months out, and you decide to start eating that way, it's going to become habit, just like it was for you or me when I began this whole downward spiral of overeating. It started, 30 years ago, maybe longer. So anyway, I hope that you are doing great, and I look forward to catching up with you next week. Let me know if there's anything else you want to talk about. Bye bye.